Hello and welcome to Straight Talk Africa Extra Time on Facebook. Whether you are connecting after the broadcast or you are just joining us, we thank you for taking the time to meet us online for the live Q&A session. Remember to join the discussion with your questions and comments using the hashtag VOA Coronavirus Africa. Our expert Tolbert Nyenswa is with us. As a reminder, he's Senior Research Associate at Johns Hopkins Bloomberg School of Public Health and former Deputy Minister of Health, Emergencies and Epidemic Control of Liberia. Tolbert, thank you for staying on to continue the discussion.
No, thank you. Thank you. It's a pleasure being here. Thank you for having me now.
Great. Let's get right into it. Although the first wave of COVID-19 pandemic progressed more slowly in Africa than the rest of the world throughout the year, by December 2020, the second wave appeared more aggressive. What are some of the reasons? Could the variants be blamed for it?
I think the people might have let their guards down. The measures, the aggressive early measures that were taken by African leaders, by the community people, by healthcare workers. I think once the cases were decreasing or going down, people felt that they were out of the woods. And so some of the measures that were taken, like wearing their masks, social distancing, and the fear has reduced and all of that. So people felt that the outbreak was over. When you do that, then you have a resurgence and surge in the outbreak of a disease. As we see right now, India is the current epicenter of COVID-19 because of some of the issues. I don't think the variant should be blamed for that. The escalating and an increase in cases are also due with the variants because of the spread of the variants. Thank you.
So we have many questions coming in from the audience, actually. A lot of questions have to do with the vaccines. I know we spoke extensively on the vaccine during the show, but let's start with the question from our viewer, Lukwago Patrick in Uganda. He says, we hear people with a history of allergies should not get vaccinations. I was reading one story and they were advising us to first check the disclaimers. How do I do that? So basically he wants to know, how does he find out about the disclaimers?
So one fact is that the healthcare provider, whosoever clinician that is giving you the vaccines, will do some brief assessment of your overall health conditions. Brief assessment meaning asking you about any chronic disease that you face with, for example, diabetes, hypertension, and other diseases, cancer that you face with. Number two, they will ask you brief history about your health, whether you are a healthy person or you are having other ailments, allergies, and all of that. So once you go through that initial pre-screening, then they give you the vaccination. It doesn't mean that once you have these conditions, you cannot take the vaccines. But what that means is to make a follow-up so that when you take the vaccine, because everybody that takes the vaccine, there's a time of follow-up. If you take the one with the one dose, you still get some phone calls and follow-ups to know your condition. If you're having some severe side effect, you go back to the facilities and report that. So it's basically assessing your overall condition.
We have Kiza Sam in South Sudan who wants to know. He says, I have a serious fever and body pain for 2 days now. What can I do? So he took the vaccine, we assume, and these are the side effects that he is experiencing. What should he do?
If you took the vaccine and you experiencing side effect, that's normal. We expect you to experience, for example, headaches, body pains, fatigue, sometimes fever. You have some, pains to the vaccine site and all of that. Those are expected. But if you are having severe pains like fainting and other things, please go to the nearest healthcare facilities because we want you to get to your healthcare provider as quickly as possible so that they can assess your condition and know whether vaccines is the cause of the situation that you are faced with or if it's not the cause. In most cases, the vaccines is not related to some of those issues. Actually, but the not severe form like the headaches and the fevers that I told you about, shows that your body is reacting to the vaccines that you've taken and building your immune system, which takes a couple of weeks.
So in the meantime, he can just take like fever reducer and things like that, and it will get better?
I wouldn't advise medication unless you speak with your healthcare provider. I took my Pfizer vaccine and I had a few side effects and I didn't take anything. It subsided within 2 or 3 days. If it's getting severe, then you go to the healthcare facility. But if it is not severe and you're just feeling pain to the vaccine sites and headaches and all of that, please sleep, drink enough water, eat well. Within a couple of days, you should be okay.
So, Tolbert, at this point, when we look at what's happening in the news, for those who are not really in tune with what's happening in the scientific community, we hear a lot about vaccination. It's something that I touched on during the show. There are over 200 vaccine candidates, as we know. Is vaccination at this point the most effective public health intervention at this stage of the outbreak?
That's the most important public health intervention that can get us out of this outbreak as soon as possible. Once we can have herd immunity created, global health immunity, I can call it. The reason I say global health immunity, one country meeting the threshold of herd immunity, vaccinating their population 70% and above is not sufficient for the rest of the world. Any case of coronavirus, any part of the world poses threat to other parts of the global community. So herd immunity should be holistic and people should take the vaccines. And what we have in the toolbox right now for COVID-19 is the vaccination. And vaccination have shown very effective because we've eradicated other diseases in the past, like smallpox. Polio is at the verge of eradication right now because of vaccines. Measles, other countries are now experiencing measles like before, yellow fever, and all of these diseases have been vaccines that help the rest of the world to eradicate them. So COVID-19 vaccines is an important tool in the public health toolbox right now for corona.
We saw that in South Africa, they had to change the vaccine to go from AstraZeneca to the Johnson & Johnson vaccine because of the variants, the South African variants that was stronger than the AstraZeneca vaccine, if you will. So how are the variants impacting the efficacy of the vaccines?
Not that much impact. It depends on country by country decisions, but all of the vaccines that have been approved right now by WHO, pre-qualified by WHO, approved on emergency use authorization by the US Food and Drug Administration. Those vaccines are safe and effective. And if you have one in your facility or in your country or with your healthcare provider, please go ahead and have those vaccines administered to you. The AstraZeneca, the Pfizer vaccine, the Moderna vaccine, the J&J vaccine that had investigation quite recently now, has been approved in a couple of days. It should be, the facility should start administering the vaccines in the US, specifically with the J&J vaccine. But though there are some rare side effects, those side effects are now included as part of the information on the vaccines. And so people are now good to take them.
A question from Nigeria, Abdulwaris Tibo Arata. He says, wouldn't it be better and safe enough for us African to buy our own vaccines rather than taking them free of charge from other countries? What are your thoughts? Because when we look at the COVAX platform, so far African countries have received, and it's not just Africa, but countries have received, for the majority, AstraZeneca vaccines. So when we know that there are more than 4 vaccines that are approved for use, and African countries have to receive the AstraZeneca through COVAX, I think he's making a good point somehow. What is your reaction?
The word is interdependent. The interconnectedness of the world shows the global public health community. So whether or not you get support from a rich country, there are rich countries, there are low countries, high income countries, low and middle income countries. Africa falls within the bracket of low, and some are trying to be middle income right now. So by getting support from the COVID initiative by WHO doesn't mean that you are getting vaccines that are substandard. The AstraZeneca vaccines are proving to be effective. The UK and Oxford University have developed the vaccines. The UK have immunized millions and millions of the population. The EU is also using the AstraZeneca vaccine. So by giving it Africa doesn't mean that it's a substandard vaccine, it's effective and it's safe, and countries should use that. The only thing I'm concerned about right now, there is huge vaccine hesitancy going on in Africa. In fact, South Sudan and other countries like Malawi are thinking about, destroying some vaccine stockpile. And imagine 1.3 billion population of Africa, only 2% of the population having vaccine access right now, when the rest of the world is vaccinating over 40 to 50% of the population. We in the rest of the world are advocating for Africa to get vaccines as soon as possible. And the African countries are not using those vaccines, and they are on a share, they are expiring and destroyed. Then it puts us in a dilemma advocating for our continent to receive the vaccines. And vaccines are very effective. That's how we get out of this outbreak.
Now, we have a question from South Sudan, Cute George, I think his name is Cute. It's from South Sudan. He says, why is the WHO and the world spending time and funds on discovering the vaccine for COVID-19 rather than investing more in treatments?
They are going hand in hand. It's just the world was able to first get vaccines that are efficacious, effective, and safe ahead of getting therapeutics and treatment. There are treatments that are available right now that being administered for people who have COVID-19 vaccine. We heard about the monoclonal antibiotics that are available that people take right now. There are other treatments that are available that the WHO have approved. It's just that we have not found new cure. I know what he's asking for is whether there's a single tablet that you can give to somebody to have cure of COVID-19. That has not been discovered. Research are still continuing. So there is no evidence of cure with medication right now, but there is evidence of treatment that's being used by clinicians. But vaccines as the most important public health tools, intervention that we have right now.
All right, we have Ashley Monjina in Kenya. She has an interesting question. Do vaccines alter the female menstrual cycle? Is there a reason to fear that there is probably a more serious effect on female reproductive health?
Thank you. Great question, Ashley. No evidence of vaccines altering menstrual cycle. In fact, now the CDC a few days ago have approved pregnant women taking vaccines right now. That's very encouraging because there are so many times lab trials that they don't want to give pregnant women to take either the medication or the vaccines. But in this case, the CDC has not approved that pregnant women can take the vaccine. So there is no evidence of COVID-19 vaccines tampering with pregnancy and male and female reproductive organs or cycles.
So John Odeni in Kenya says, what's the difference between Chinese vaccines and other vaccines that have been developed by other countries? We heard about the mRNA science behind vaccine like Pfizer and then adeno vaccine. So what is the difference when we look at the Chinese vaccine?
Now, what is being approved right now is your Moderna vaccines. You can take your AstraZeneca vaccines, Pfizer vaccine, J&J vaccines have been approved. They are all pre-qualified by the World Health Organization. That's the legal body responsible for health. The US Food and Drug Administration have also approved 3 vaccine candidates, the J&J, Pfizer, Moderna. There are other vaccines candidates that being globally, WHO is observing and watching other vaccine candidates, but those have not passed the pre-trials, the clinical trial. Vaccine go through a lot of steps before it gets to approval. There are phase 3 randomized clinical trial that have to go through. That's the gold standard of any clinical trials that you think about. And vaccines go through the rigorous testing before they get to the public for use. Even when they are authorized, there is a monitoring system called the Vaccine Safety Monitoring System. And this is why you see the system put in place for monitoring vaccines after they are authorized and in the population for use are working very, very effectively. This is why we are able to trace fewer cases of blood clot in millions of people that have taken vaccines. So what you have available, please use it. It's effective.
Now, this is something that when I found out, I was really surprised that only 1% of vaccines that are used on the continent of Africa are made in Africa. So, which means that 99% are from the rest of the world are shipped in Africa. So when we saw how the world has been mobilized in the race against a vaccine against COVID, which led to several vaccine candidates being developed within a year, first in vaccine development, really given how fast this happened. Where does Africa stand in this picture? When we will see a vaccine made in Africa against COVID?
So it's a long process. It's really countries that have developed the COVID-19 vaccines that we see right now. It didn't start with COVID. It started long years. For example, those private sector companies like Moderna, Pfizer, J&J have been in the pharmaceutical industry for decades. And so the capacity, financial, human resource, equipment, logistics, and factories were already there. The RNA vaccine is the first time that that is being used for vaccination, but using RNA with other therapeutics and clinical trials is not new. So basically, Africa, I was excited recently when I heard about the 12 to 13 April meeting that was held by African leaders through the leadership of the AU and the Africa Center for Disease Control. That's the starting point, the political will to get vaccination. As you said, Lerna, you correct when you said we're only producing less than 1% of the vaccines that Africa use. For Africa uses, for example, we use 25% of the world vaccines, the 1.3 billion people. And only 1% that is made in Africa. You think about countries like South Africa, Senegal, Nigeria, that is trying to use some of those things, yellow fever vaccines and all of that. And so we are a long way. But the short-term thing, like the Africa CDC is proposing, is how can we get some of those vaccines on the ground in Africa, especially with COVID, since we're in an outbreak right now, to increase our production on the continent and get more COVID-19 vaccines. As I said earlier, only 2% of COVID-19 vaccines has arrived on the African continent. This is a huge gap that we're dealing with right now. And so we need capacity, we need financial resources, and these countries that are producing these vaccines are not government. They are private sector investments. So Africa needs to come together and bring the private sector investment together with government political will. It's doable. We have people who are trained to do that on the continent. They are experts. They have facility. We did it in Liberia. In the middle of the Ebola outbreak, we done a research with Ebola virus vaccines. It was done in Liberia, Guinea, and Sierra Leone. So we have the experience on the continent. There are colleagues that have worked with at Ibadan University that were doing some setup with research at Ibadan with mental health and other health issues that affect the continent.
So on April 13th, the Africa CDC announced the partnership to develop vaccines on the continent, but it will take some years. It's not going to happen overnight, at least 10 years, if I'm not mistaken. So what happens until then? I guess my question is really what took so long? I mean,
it's not one size fit all. There are a combination of issues. The financial is number one, having the resources to do it. You know, our health systems on the continent, though I'm not overgeneralizing that all of the countries have the same health system, they are better. Other countries with better health system, there are other countries that are still struggling with their health system. But basically, our health systems are driven by, they are infectious disease-based driven. Malaria is the number one killer on the continent. It's the leading cause of mobility and mortality, especially in children under 5 and pregnant women. And a lot of our budgets and resources and revenue, we put more money into buying drugs, medical supplies, curative services, than thinking of preventive services. So, and research takes time. It's not like giving a tablet to a patient and finding solution the next day or in a couple of hours. It's about finding the resources, building a platform, putting in the equipment, collaborating with private sector. So our governments are not looking at research yet. Right now, the health systems are curative based. That's why taking the time. Unless we invest into research, some of the universities that want to do research through the private sector and creating the enabling environment as a government, that's how we get, to where other countries are right now, like India, like the West, global North, that are doing vaccine research overall. That's what they do in the system.
So let's come back to the blood clots that we touched on earlier. We have a question from Stafford Mwambola. He says, what percentage of people are experiencing blood clots after vaccination?
We don't know the exact percentage, but we know that it's very rare and minute portion, very, very tiny. For example, imagine the United States has administered over 130 million doses of vaccine, about 40% of the population, and we're just talking about less than 10, 13 persons that have blood clot using the Johnson & Johnson vaccine in female between the ages of 18 and 39. That number is very, very, like in Sweden, they administer millions of the AstraZeneca vaccine. In UK, 13 plus million people. In Israel, all around the world, the vaccines is being administered. But those rare, very unusual cases of clot do happen. And when they happen, it needs to be investigated. This is why they pour hot to the Johnson & Johnson vaccine to get to the bottom of what was going on. And once the investigation was done, that was lifted and the vaccines are now being administered.
Sir Eric Dentor asks, do African countries have adequate supplies anyway? It looks like many people want to access the vaccine but can't have access. We saw the gap in vaccine access. One of the reasons why COVAX was established by the WHO was to reduce that gap. So at this point, how does it look?
The gap is still huge. As I told you, we have only 2% of the vaccines on the continent right now. When I was looking at the report from the presentation that was made by my colleague at the Africa CDC, John Kenkerson, he was saying that by 2022, they want to vaccinate at least 60% of the population on the continent, 60% of the 1.3 billion people. And now we have only 2% of the vaccines. That's huge gap. But what I'm concerned about much is the vaccine hesitancy, the fear of side effects that people are not taking the vaccine. The initial doses that were supplied on the continent, there are countries that still have them in their warehouses and are not using them. So my appeal here is the vaccines has saved the benefits of the vaccines far exceed and outweigh the risks that we are thinking about. let's take them. And let me tell you the paradox here, from an experience dealing with the Ebola crisis. Though Ebola is so virulent and more severe than COVID-19, and you see when the risks is not there, when people don't see the visibility of the risks, then they tend to not take the measures that they're supposed to take. I live Ebola. I saw situations where people were looking for anything, barely anything that they could get to treat Ebola. People were using meth and a lot of other substances, and we were looking for vaccines. I remember we had 10 of our healthcare professionals, very, very senior, in the Ebola treatment unit, and we needed something to treat them. We have only 3, there's a drug called ZMac, 3 doses of the ZMac drug that the US government had pre-approved on emergency basis. We were thinking how many people to give the ZMac medication to. And we were looking and yearning for vaccines. Now we have vaccines that are available. Let's take the vaccines, they are effective, they are safe. And this is where we are advocating for the COVAX initiated by WHO to raise more resources and purchase more vaccines. And also the manufacturers should make more vaccines so that we can have global health immunity.
So here's a question that's related to what's happening now in India. Savuya Sona, I think I'm saying this correctly, says, why is COVID-19 pandemic spreading at a faster speed in India, and yet they are the ones manufacturing AstraZeneca vaccine? Should we really trust this vaccine? So it seems like people are really skeptical about AstraZeneca vaccine. What is your reaction to maybe what we're seeing in India?
The 4 candidate vaccines that are in the population right now that's being administered are safe. I would, tell people to take the vaccine. They are safe and effective. The benefits outweigh the risks, as I said earlier. With the situation in India, like even yesterday, the Johns Hopkins Bloomberg School of Public Health, we have an institute of Indian study. Our colleagues we're having an important technical meeting tomorrow to study the situation in India and what support that Johns Hopkins, the US government have taken steps already. I sent almost 60 million doses of the AstraZeneca vaccines to India. And so we are all investigating the situation going on in India, whether it's due to variants, whether it's due to people not taking proper public health and preventive measures, but a combination of things need to happen. People in India need to take it serious and take their vaccines when they are available, use their mask, social distancing, and so that we will get rid of the outbreak there. And this is where Africa needs to be very, very careful and take all of the measures, because there could be a spike, there could be a flare up of cases in Africa, because no country is out of the woods yet, no continent is out of the woods yet. This outbreak is still real and it's raging and killing people.
And what do we do? I mean, we're going to end very soon, but it will take several months before the vaccine stops the transmission of the virus on a large scale. Meanwhile, how do we interrupt a third wave in Africa? We've seen that the second wave was more daunting on the public health system and on people on the continent. So how do we stop a third wave?
So we've seen light at the end of the tunnel right now. The reason I say that, I was looking at the statistics in the New York Times as compared to imagine the United States was the epicenter of the outbreak. The entire world was worried about what was going on in the US, in nursing home, in hospitals, and everywhere. Because of the immunization, vaccination that have gone on in this country right now and the other public health measures, we see the decrease in mortality. Now, Africa is in a better position because we've dealt with a lot of infectious diseases, for example, Ebola in East Africa, Ebola in West Africa that I there were the incident manager when it was in Liberia between 2014 and 2016. And we dealt with Lassa fever in Nigeria and other places, polio eradication program on the continent. So we used to infectious diseases. There are measures that you take when there are not therapeutics around or vaccines, pre-vaccines or therapeutics. There are measures that you take. With COVID, please continue to wear your mask. Let's do our social distancing. That's important. Hand washing, important. Set up incident management systems that will follow the outbreak, contact tracing, and all of these public health measures that we know until vaccines can arrive on the continent that we can immunize 70% of our 1.3 billion people on the African continent. Those would be my public health advice.
And that's a nice way to wrap on this advice. Tolbert Nyanswa, thank you so much for your time. We appreciate you being with us today.
Thank you for having me on.
And thanks to all of you who have joined us here on Facebook and for your questions and valuable contributions. This concludes the special edition of Straight Talk Africa on COVID-19 1 year later. Stay connected at voanews.com or follow me on Twitter at Linord Moudou. Until next time, take care, stay safe, and as always, strive to make every day a healthy day. All right, thank you.
Guys, this was fantastic. Thank you so much. Thank you both. You're both great.